Seizures are very scary and mysterious to a lot of people. I think that one of the big misconceptions among patients is that seizures consist of the type of seizures that they see on TV, which is fall down, shake all, your arms and your legs, huge, big seizures. And there are a lot of people who have smaller seizures for years and don't even consider the possibility that it is seizures or epilepsy that's the problem. So, a funny feeling that comes out of nowhere, sometimes just a rising sensation in the stomach, a deja vu, that then is associated with just a little bit of fogginess or confusion for a minute or two. These things also can be seizures, and those are often overlooked. And unfortunately, the person doesn't come to medical attention until the big seizure with shaking and falling on the ground happens. And that could have been avoided. And one of the things that we found looking over the literature that is that in fact the first seizure is usually not the first seizure, that they come with the big seizure and think it's the first seizure, but when a history is taken, you find that many seizures have occurred before that. I think a lot of people are still sort of stuck in the mindset that all seizure medications are potentially going to cause people problems, or going to make them feel bad or harmful or dangerous, when fortunately in this day and age we have a lot of new medications that people can take one pill every morning when they wake up, feel perfectly fine, have no adverse consequences of their medication. And whereas doctors are very comfortable treating for example, with a statin or a blood pressure medication every day, even when a person doesn't have a disease yet, they don't feel as comfortable treating with a seizure medication every day. And in some cases, that absolutely is warranted to prevent further problems. I mean, it's very difficult to make a choice among medications because a lot of times it has to do with avoiding specific side effects that can occur in populations at risk. So you have to know really a lot about your patient and what they currently, what their current characteristics are, and match a drug to that patient. But if you do that well, you can certainly, among all of the medications, and I think that the availability of new medications is really about choice, so that there is a good drug for any person to avoid problems, whereas before, when there was only a limited number of medications, you couldn't necessarily avoid problems. So we're better at doing that now and giving people drugs that really they can tolerate very well and take for the long term.